Hi, welcome to the section of cardiology. This is Dr. Jaitly. Here I'm going to be talking to you about what is systolic heart failure versus diastolic heart failure. Now you note that in my previous presentation I just reviewed different types of heart failure and did not allude to systolic versus diastolic in there. Why? Because this deserves a special video talk. The reason is because this is where we are talking about the actual disease, what is really causing a heart failure, even in a setting where the ejection fraction, which we'll talk about in a second, the contractility is preserved, or in a contractility which is not preserved, and so on and so forth. So let's see. Heart being a four-chambered organ, here's my favorite schematic, which I always use it because it gives you the structures of the heart. So just to recap, left ventricle is the booster chamber, which is sending blood up in the aorta. So now, just like any other house or any other room has a dimension, the length and the breadth and the height of the ceiling, like in your house, similarly, the heart has its own dimensions normally. So when you have a normal dimension, say, assuming that the left ventricle has a volume of 150 cc's, here we go. End-diastolic volume, which is when the ventricle is totally relaxed. That means at the end of diastole, 150 cc's is the volume. Now, at the end of systole, the volume is reduced, obviously, right? Because the heart contracts. Now, when the heart contracts or squeezes, the left ventricle squeezed, the volume now is 70 cc's. Now, this is dynamic here. So 150 minus 70, that gives you the stroke volume. The stroke volume is therefore 80 cc's. What is it? 150 minus 70, that's 80 cc's. Now that is normal. So now if you take the stroke volume times the heart rate and compute that into this equation, 80 cc's times, say the heart rate is 70 in normal individuals, you get 5.6 liters or 5,600 cc's per minute is your cardiac output. So what have we learned so far? We have learned the end-diastolic volume. We've learned the end-systolic volume. Subtract that, gives you the stroke volume. That means that's the amount that has been ejected by this guy, the left ventricle, into the aorta. So every beat, the left ventricle is ejecting 80 cc's. And times that with the heart rate gives you the cardiac output. Simple? So look how much you've calculated out of the simple numbers here. So 150 minus 70 gives you the stroke volume. Stroke volume times the heart rate gives you the cardiac output. Now, what is ejection fraction? You must be wondering. Well, ejection fraction is a percentage of the amount that's ejected per beat, but at the same time, it's calculated based on the amount that was originally to begin with. So the original volume to begin with was 150. It ejected 80 cc's. So 80 divided by 150, right here, times 100 will give you the amount of ejection fraction. Now in this setting here it's normal because 50 to 55 is normal LVEF, and that's called 53%. Here it is 53% calculated. Now take the other example. Here the end-diastolic volume to begin with was again 150 cc's, just like here, but the end-systolic volume, that means the ventricle did not contract too well, end-systolic volume is still 90 cc's. That means it did not eject so well. So 150 minus 90, the stroke volume was only 60 cc's. Here the heart is sending up the blood, but not as forcefully as it was doing in the previous examination. So here the left ventricular ejection fraction will be low or high? Low. Obviously it's not ejecting as much. So the cardiac output will be low, the stroke volume is low, and the ejection fraction is low. I make it very simple. So left ventricular ejection fraction will be low by the following numbers. 60 divided, again, you're taking the 60 cc's of the stroke volume, divide that by 150 and multiply that by 100 will give you the 40% as the answer for the left ventricular ejection fraction in this setting where the LVEF was reduced, and we call it LVEFr. Here the LVEF was preserved, so we call it LVEFp, preserved. So you could have a diastolic heart failure where there is no reduction of left ventricular ejection fraction, like here, because the LVEF is preserved. Or you could have a systolic heart failure where obviously the LVEF is reduced. Simple. So systolic heart failure implies where the left ventricular ejection fraction is reduced, like here. And diastolic heart failure implies where it is preserved, like here. And remember, the causes are different, treatments are different, so the whole ball game is different between systolic and diastolic heart failures. So those are, I always say that they are two different creatures. These left ventricles are two different creatures in one, where you have a preserved left ventricle function and the other one is a reduced function. So, well, stay tuned for more intricacies as we advance in our thinking and knowledge of our cardiology here. Okay, I hope I've been able to share this knowledge fairly, simplified to you all. And please share it with your friends, and let's discuss more in our future presentations. Looking forward to. Have a good one. Thank you. Bye.